Good day, colleagues. My name is Dr. Mary Mazo. I'm going to present to you some research results from the work that was conducted by Kwaka Indoda on gender norms and gender equity as drivers of health services uptake by men. As an introduction, HIV prevalence in Eswatini is at 27% and is still considered the highest in the world. Though this incidence has declined since 2010 due to treatment coverage, fewer men know about their status in terms of HIV than women. Studies show that the men's health-seeking behaviors are relaxed and the men are reluctant to access healthcare services or they even avoid healthcare services. Progress has been made in control of HIV, but this reluctance threatens women and girls and leaves them at risk of HIV infection. Kwaka Indoda, the male mentoring organization in Eswatini, which specializes in community-led health interventions, carried out this research to find out on gender sensitivity and health-seeking behaviors of men. The objectives of research was to collect preliminary qualitative and quantitative data on men's health-seeking behaviors and their perceptions on gender equity. And another objective was to conduct dialogues with the men to find out the barriers towards their uptake of health services. In terms of methods, we conducted a survey and we collected qualitative and quantitative data. We administered questionnaires which were guided and self-administered, and we also carried out dialogues using closed-ended questions for 15 questions on self-assessment and GEM scale. We participating with 599 men from selected rural and urban areas of Eswatini, and the questionnaires and the dialogues were analyzed using MS Excel, and we performed also a trend analysis on the dialogues. The results of the research in terms of health risk self-assessment indicated that men in Eswatini still engage in sex without a condom, even with somebody they don't know about their history. They also believed circumcised men are safe from HIV, and when they get STI, they do not usually visit a health facility. The STI prevalence was about 29%, which is also equal to the national HIV prevalence. In terms of gender equitable men analysis, men in Eswatini believe care roles are for women, and they believe they have a final say in the home decisions, and they should be tough, and they expect their wives to respect them and not to refuse sex, and they feel they are always ready for sex themselves. Some men, however, believe that avoiding pregnancy is not a woman's responsibility only, and they also didn't believe that paying lobola means owning the wife, and they didn't believe in husbands beating their wives and women not tolerating violence to keep their families. They also believed further participation in the children's life is very important. The dialogue analysis revealed the barriers to access to health services as related to service provider attitudes related to confidentiality and disrespect, service delivery issues, access to health services in terms of costs, and some gender norms like being tough, and also cultural and religious beliefs. However, there was a consensus on need for separate male facilities and separate male health care workers specifically for males and flexible times for males, especially those that go to work, they needed flexible times for health services provision. These results show that gender norms in Eswatini are strict and being followed, but there is progress in adopting gender norms that instill positive masculinities. Among the gender norms, some of them directly influence HIV transmission, and some of them prevent women from making decisions about their lives, and they also perpetuate violence against the women. In terms of conclusion, I'm concluding, men in Eswatini are aware of their risk to HIV, but they somehow engage in risky behaviors. They also feel that they are responsible for making decisions and women should just listen to them. And the research showed that Eswatini is a gender equitable society, which is medium level because the Gender equity score was 0.7, slightly above media and slightly in the high level. In terms of recommendations, these results are going to be published into a document or into a publication, which can be used by development partners, policymakers, to inform future programs on neural health-seeking behaviors. I thank you for listening.